Doc.
Hi,
My name is Abigail Affle, and you are
and I'm Araba here.
Araba here. So I'd like to engage in a very short session on
Okay.
infertility. I hope I have the chance.
Yes,
All right.
please.
So, Doc, can you tell us briefly what infertility is?
Okay, so infertility is when a couple is unable to achieve conception after 12 months of unprotected intercourse.
It's very good. So we would like to zoom into causes of infertility in women. But
Okay,
before we talk about the causes, can you tell us some of the risk factors that predisposes a woman to be at the state of not being able to conceive?
okay, so normally there are some major risk factors.
All right.
So normally when you wait till you are very old before you try having a child, so um when your maternal age is around 35 years and above, it
Okay.
becomes very, very difficult for you to try and be able to conceive.
All right.
And also, when you are very fat or obese,
Obese.
yes, obese women also have problems in childbirth.
So those are like the very major
the
risk
very
factors.
major
So late childbearing age and
Yes.
then obesity.
obesity.
Right.
Yes.
So now let's zoom into the causes, especially in our region, Ghana. What are some of the major causes of infertility in women?
There's a disease known as polycystic ovarian syndrome.
What is that?
So the polycystic ovarian syndrome is a hormonal imbalance.
Okay.
So it comes about when you have follicles growing in your ovaries. So poly means 3 or more.
Okay.
So when you have these follicles growing in your ovary, it doesn't enable you to produce healthy enough eggs to be able to cause menstruation
Oh, okay.
or even for you to ovulate. Polycystic ovarian syndrome is something that we don't really have much idea about it in Ghana, for instance.
All right. That's like a major cause
Yes,
of
it's
infertility.
a major cause of infertility.
And what about the others?
Okay, so then we have what we know as uterine fibroids.
Okay.
So that's also another major cause of infertility.
So now we are going to say something.
Yeah, I'm going to talk about pelvic inflammatory disease
Okay.
as well. For that, there are a lot of causes that fall under that.
Mm-hmm.
So normally when you begin having sex at a very tender age, when you are changing your sexual patterns and you don't use protection, and sometimes when you have a urinary tract infection or past history of abortions, it can lead to a PID, which could hinder you when you're trying
Getting
to.
pregnant.
Yes, please.
All right. So now let's delve deep into uterine fibroids. It looks like it's the order of the day in our region here.
Yeah.
So what are uterine fibroids?
They are basically non-cancerous growths.
They are not cancerous.
Yeah,
It's not
they are
cancer.
not cancerous.
Okay.
That affects women of childbearing age.
Okay.
And there are a vast number of risk factors that predispose women to having a uterine fibroid.
Tell us about it.
Okay. So like I was saying earlier with regards to the causes of infertility, they also fall under uterine fibroid.
Okay.
So when you are having a very high, that's when you wait till you are very old before you try and giving birth. It's a very serious risk factor. And then obesity as well.
Wow.
And then when you have a strong family history of uterine fibroids, maybe your mom, your grandmother, your auntie suffered from that, you are likely to also develop uterine fibroids later on in the years. And there are also some risk factors as well. It's very common in Black women.
Tell us. We really want to.
It's very common in Black women as compared to the whites. So most of the patients that come to the hospital, they are all suffering from uterine fibroids as opposed to those in other countries. Yeah.
All right. So specifically obesity. So
Yeah.
that means you're doing such and so, and then we engage in exercises to lose weight more often. Genetic distance, right?
Yes.
So if my grandmother had
from
fibroids, there is a possible chance that I would also get it.
Yeah.
Okay. How about other life factors? Alcohol, smoking.
Okay, so you know when you have diabetes as well, it's also predisposes you to having uterine fibroids.
Wow.
Yes.
Wow.
And hypertension as well.
So it means that when I have all these conditions, I have to make sure I get them treated.
Yeah, you have to get them treated. You shouldn't just stay at home and say, oh, I'm buying to men, and then you just stay at home and then you are doing nothing about it.
Right. It is a situation you have to make sure you get attention from them, else will complicate it getting uterine fibroids. It's very, very good information. All right, so are there any other causes of uterine fibroids?
Okay, so basically uterine fibroids, the exact cause is not known.
Okay.
But from what I've said, these are the likely risk factors that are known to cause that.
So there is a school of thought that when you menstruate and you don't have all of your blood coming out, sometimes a woman will bleed for her usual bleeding period is for like 4 to 5 days. But when she, in a particular month, when she bleeds for 3 days, there's a school of thought that the rest of the blood that didn't come out the other 2 days have clotted to form uterine fibroids. How true is that?
Okay, so like you said, it's a school of thought.
All right.
Because most patients are coming with fibroids. The symptoms they present with is abnormal uterine bleeding.
Okay.
So some may claim that uterine fibroids, when you are not really menstruating well, it causes the blood to form a big clot and then it develops into a fibroid. But it hasn't really been, like, there hasn't really been much research to show that it's actually true.
What is happening?
Yes.
Okay, so fibroids, are fibroids like blood clots, or they are, say, muscle tissues, uterine tissue that has become very huge? What at all? Or it's like a stone? What at all is a fibroid?
So fibroids are basically smooth muscle tissues that have come together to form.
So that's like the tissue of the womb, the usual womb. Okay. And it enlarges.
Yes, please.
Right. Okay, so what are some of the symptoms? If somebody has a uterine fibroid, how would the person know he or she has a uterine fibroid?
Okay. Basically, majority of patients experience no symptoms.
Wow.
Yeah, so they may find out that they have uterine fibroid on a routine pelvic exam. Maybe, my main course is when question say, and you go and they say, go and do an ultrasound test. And then you go, they find that, I have fibroids. I didn't even know about it. I'm okay. Like, what's wrong with me? So basically, most patients have no idea that they have fibroids because they have basically no symptoms.
Okay, so the plan here is you have to, whenever you're experiencing any symptoms down there, you are feeling funny in your lower abdomen region, we are advising you to just see a doctor. Great. But how about those small group of people who would experience symptoms?
So like I was saying, some patients experience abnormal menstrual bleeding.
Okay.
So when you are bleeding, that's not like following the normal pattern. You see, the normal pattern is you have to bleed for about 4 to 5 days.
Yeah.
But your cycle is going on for more than 6 days. Like, what's going on? So when you go to the hospital, they'll run some routine tests. So then they will take your blood and then find out that you have anemia. So they want to run further tests to
anemia,
know. Anemia is
patchouli.
So be like, okay, let's find out what is wrong with this patient. So they'll run further tests and find out that, she actually has a uterine fibroid.
So let me get this straight. So if, say, the usual days I'm supposed to menstruate is, say, 4 days or 5 days, but I end up bleeding for like 7 days, 8 days. I keep changing my pad. It's a red flag for me, right?
Yes, it's a red flag. And we found that most of those patients, they see clots in their menses, and they experience very severe lower abdominal pain.
Oh, okay. All right. Any other thing? Some people also tell me that, I had a friend who told me that when she's menstruating and she sits on the pot to pee, whenever she gets up, the pot is like flooded with blood.
Yes.
It's also a sign.
Yes. And then some patients too, they have distended abdomen, so their abdomen keeps enlarging. Yes. And they feel funny in their tummy. Like,
they are not pregnant,
but they are not pregnant, but their abdomen just keeps enlarging. And then
somebody also told me, as a baby nanti.
Baby nanti.
Oh, so it's actually
so
true.
When they come, doctor told me, if you listen, baby nanti, it's a red flag.
Right.
Some women, because they want to get pregnant, be like, I'm pregnant, let me just stay there.
Okay.
Then they begin to experience more severe symptoms.
Oh, okay. So any other symptoms?
Okay. There are also some pressure symptoms. So maybe you are having urinary urgency, frequency, and also sometimes it causes some symptoms in your bowel as well.
Sorry, the urinary agency, as in Johanna Johnson. Okay. Now Johnson Bebre.
So you have to check that out.
And you can't hold up
your urine. Yeah.
And then about the bowel.
The bowel. So sometimes they experience constipation. You may think that, oh, I ate something and my tummy is reacting to it, so let me just stay at home. But in our setting, we are taught that, oh, when you don't have money, just stay at home, don't go to the hospital. But I think now with the way we are experiencing these problems, the slight chance you get, you should visit the hospital to check what's going on.
Oh, all right. I think that's very. And then, is there any way uterine fibroids interact with pregnancy? Aside the fact that they can't even make you to conceive in the first place, when you conceive, do uterine fibroids also play a role? Is there any way uterine fibroids interfere in normal pregnancy? Let's say to me and you say, can the uterine fibroid ne akran to me atsna or dinima isusa so be a maswana?
Okay, so most patients the fibroids are able to cohabitate with the baby without causing any symptoms. But some women as well, when you are having a fibroid that is very, very large, and like you were saying earlier, there's a school of thought. So that school of thought also says that the same hormones that promote the child to be able to grow is the same hormone that causes the fibroid to also enlarge.
Okay.
So there are some women that may come and then they are pregnant, they're having a fibroid. As the baby is growing, the fibroid is also enlarging. So you can imagine when you are having two objects trying to cohabitate in one uterus. You can imagine there will be competition.
All right.
Yeah, like how Charles Darwin spoke about it. So it means that one will have to be able to survive and then the other would die out.
All right.
So when that happens, it can cause miscarriage.
Oh, okay.
Or then be some other complications with regards to the pregnancy.
So if a woman is having recurrent and frequent miscarriages, you have to see a doctor.
You have to see a doctor to find out what is going on.
Great. Okay, so when I come to the hospital, which investigations do you usually do for us? Do you do vaginal examinations? Do we take scans to investigate for fibroids in particular?
Okay, so when you come with a uterine fibroid, the baseline test is the ultrasound. In the ultrasound, we have two types. We have the transabdominal and then the transvaginal ultrasound. And then we'd run some other lab tests as well. So the urine test, we'll have to check your HB as well to know whether you're having a low...
HB is what? The level of my blood.
Yes. Right. So we'll have to check the level of your blood. Because like I was saying, most patients suffer from blood loss during...
Oh, that's what rendered them anemic.
Yeah, rendered them up. So we have to check your blood level as well. Then we run some other lab tests that are not really in line with...
Just to be sure, to rule out other causes.
To rule other causes.
All right. Okay, so I believe that most women who have fibroids, because they bleed, they would also tend to be so anemic and then have anemic symptoms.
Yes.
So can you tell us some of the symptoms that I will experience to inform me that, I need to see a doctor?
Okay. So basically, number one, dizziness. So you need to be there then you feel dizzy, you feel like the whole world is spinning.
Okay.
And you see, because it's one symptom of pregnancy, women may just think that, it's nothing, let me just stay at home. But it's actually a symptom of anemia. And then when you are sweating, you sweat a lot.
Okay.
You are feeling tired. Now I break. And then sometimes too, when you look at your eyes, when you are suffering from pallor, your eyes look pale. These are all symptoms of...
Some people also say they feel their heart is beating.
Yeah, you feel your heart is beating very, very fast.
Yeah. Okay.
These are all symptoms
of anemia. So if you are bleeding too much, even aside fibroids, if you are having abnormal uterine bleeds and then you experience all these symptoms, you should know that you have anemia and you should see a doctor.
Yes.
Right. Okay. So Back to Jaggery Fertility Clinic. So if I come here and then you realize or notice from the investigations that I have fibroids, what do you do for me?
Okay, so with fibroids, when we find out you have fibroids, we look at the size of your fibroids, and then we look at the location as well. So all things being equal, when we look at all of this, we'll counsel you, and then we'll discuss the treatment options with you. Yes.
Then you go ahead. So the treatment options, how do you treat fibroids? Is it solely medical or surgery? Especially, what do you do here in Jaggery?
Okay, so at JAGGREY'S, we treat solely with drugs.
Okay.
So when we have very, very severe complications, then we advise patients to go in for the surgery
so that they have it removed.
Yes.
So the point here is you have to report to the clinic fast enough so that you'll be attended to before it gets complicated.
Yes, please.
Oh, that's nice. Have there been successes so far since Jaggery was established?
Yes. As of now, most of our patients that we receive, they are mostly suffering from uterine fibroids.
Okay.
So most of them, when they come and then we detect it quickly, you're able to help give them drugs that would shrink the size of the fibroid. Okay. So most of them, they get pregnant and then it doesn't cause any symptoms with regards to the pregnancy. Yeah.
Have there been instances where the fibroids that you shrunk have recurred as a and the woman came back to the clinic?
Yes, please. So some women may take the drug and then you don't come in for a follow-up test. So be like, oh, after the baby are okay, then you just go and sit at home. You don't follow up to see must I take further drugs or run further tests, or should I stay away from some foods? So you're just at home living a carefree lifestyle. So it may cause your fibroids to increase in size. So it has also occurred in our facility.
Yes, so it's basically because the patients default, they're not compliant with their drugs, and then they cause them to recur.
Yes.
All right. So, Doc, before we sign off, any final words to the general public, especially women with uterine fibroids?
Okay, so I would like to tell all women that having a uterine fibroid is not the end of your life. So it may be that you are trying to have a child and it's not forthcoming. But you should visit a hospital and discuss your treatment options with a doctor so you know the best way forward. If you go with the medications or you'd prefer to have a surgery done. And then, like I was saying, lifestyle modifications. So we should take in more vegetables, okay? And you should stop trying to, let me just live a carefree lifestyle. So watch your weight and then make sure that you are trying to live within your means. So I think that's what I can tell all my patients and everyone watching.
Thank you very much, Doc. Jaggery, House of Babies.
Exactly.
I believe that whoever that works in here would go with this testimony.
Yes.
Thank you very much, Dr. Araba here.
Thank you too.